Hi, guys. My name is Ali. I'm a third year medical student here in Southern California. And what I'd like to do today is talk to you a little bit about some of the applications I use on my Android device while I'm at the hospital. Now, a lot of the times, this is also going to be compatible with iOS. In fact, I do have my iPad Air, and it basically has exactly the same applications that I'm going to show you. Now, over here, I'd like for you to focus on the top four applications, four resources that you're going to be looking at for a refresher, a quick refresher about a certain disease, or if you want to look for a particular treatment option, or if you want to look up basically anything in terms of diagnostics and whatnot. So I'll go ahead and delve into Lexicom. And Lexicom gives you this screen over here where you could find the library of resources that you want, some drug interactions that you can look at if you need to identify a drug, calculator, and whatnot. I basically focus on this library section right over here, but you can delve into the others as you wish. So if you click on library, what I have over here on the top is the 5-minute clinical consult. And now, what the 5-minute clinical consult is exactly as it describes. It's basically your go to for a quick refresher about a certain disease, its etiology, and basically all the diagnostics, what you want to ask for your history, the pertinent things for your history, for your physical diagnosis, and treatment options, et cetera, et cetera. So I'm doing my OB-GYN clerkship currently, so I'm going to go ahead and click on AUB, abnormal uterine bleeding. And as an example, you just scroll down. It basically gives you all the information that you really need here. So for example, if I'm seeing a patient and they're describing to me that they have abnormal uterine bleeding, and I need to look up a treatment option. I'll go ahead and click on this AUB, click on jump on the top right there. And if all I need is treatment, I just click on treatment down over here. And look at that, it gives you the first line treatment, the dosage for that treatment option, and second line, et cetera, et cetera. So this is a great resource when you need a quick refresher. And basically, all these resources are for quick refreshers. If you need something a little more exhaustive, then you're going to go ahead and go to your different books and resources respectively. So that's that for Lexicom. Now, a little thing about Lexicom is that it does cost money. It's pretty expensive if you're paying for it. But a lot of hospitals, if you go to the library section, they do have a subscription for the hospital, and so you could just add that, and it'll be free. Like in my hospital, they happen to do that. So if you're looking for something free, Medscape is a great option as well. Sometimes I go to this one because it's sometimes a little easier to read. It's not as dense. So if you click on Medscape, it's going to go ahead and give you this kind of screen right over here with the search query on the top. And my recently viewed one, you basically type whatever you want, but I'm going to go ahead and click on that, the hypercalcemia, and it manifests this screen right over here. So it's basically, that jump screen that I showed you with Lexicom. This is basically its jump screen. So if I'm looking for treatment options or a workup, let's say workup, then these are approach to consider, approach considerations, and you could just read on it as you wish. Imaging studies, etc., etc. Treatment options, medical care, what you're going to look for. And so this is a great resource if you're looking for something that's pretty nicely edited, and also free. Then this is a great option for you. Now, for the third option, which is actually the most popular option at the hospital and with many medical students and medical professionals, that is UptoDate. So I'm not gonna click on UptoDate because I actually need to resubscribe. I need to purchase my own subscription for that. But a lot of you actually understand and know how to use UptoDate, and that's a really good option. For those of you that don't know, there's another option to UptoDate. It's actually one of its leading competitors, and that is Dynamed Plus. And that's over the fourth one I'd like to talk to you about. So Dynamed Plus, if you have a subscription to the American College of Physicians, which I do, it comes for free. And so if you click on it, you basically type in something that you want to search for. So I have here as my previous searches, hypertension. So I go ahead and open that up and scroll as I wish. And these are certain, different types of hypertension that you want to look at. Let's say it's just hypertension in general right there. If you click on the top right, see that magnifier with the different lines next to it on the top right? This is basically Dynamed's jump option. Like how Lexicom and how Medscape had a jump option, this is basically that option for the different sections as well. So if you're looking up something that you want to ask for the history and physical, you just go right to it. So you go to the history and physical and you read up on the pertinent things that you want to ask and that you want to look for these different items. If you want to look for treatment options, go ahead and click that top right area, click on treatment, and there you go. It has your BP goals that you want to do. You want to look at with JNC 8 guidelines. Depending on what level the evidence is, this is kind of nice and it's specific to Dynamed Plus. It gives you level 1, level 2. You can kind of see it right over here. It basically tells you if the evidence is really reliable, if it's moderately reliable, or if it's not likely as reliable. And so it kind of rates it for you so you know, and you can make your clinical judgment based off of what you're looking at right there. And what's nice about Dynamed Plus is it's actually been shown with some research to be actually more up to date than UptoDate. So I know that's kind of ironic, but some of the research actually points to Dynamed being a little more updated. But I use all four of these kind of interchangeably, and they're really good for in terms of refreshers, in terms of what you need, quick at your fingertips, quick information that you really need. These are great resources. I hope you found this video useful. I hope you find these applications also very useful. If you have any questions, comments, or concerns, please leave them in the bottom on the comment section, and I'll catch you guys later. Please like and subscribe and share this video as much as you can. Thank you, and take care.